Microbiology practice and quality assurance in district laboratories. Question and answer format. Why is there an urgent need to strengthen clinical microbiology and public health laboratory services in tropical and developing countries? Answer is there is an urgent need because of high prevalence and increasing incident of infectious disease, re-emergence and rapid spread of previously controlled disease, emergence of new pathogens and new strains of existing pathogens, increasing antimicrobial resistance, need for reliable microbiological data for treatment and disease control. Then, which infectious disease are highly prevalent in tropical and developing countries? The answer is acute respiratory tract infection, typhoid fever, cholera, dysentery, tuberculosis, meningitis, whooping cough, plague, HIV/AIDS, viral hepatitis, yellow fever, dengue fever, and viral hemorrhagic fever. Now the question comes, how do climatic changes they influence infectious diseases? So climatic changes such as global warming and extreme rainfall they increase the distribution of the infectious diseases, particularly with the mosquito borne and waterborne diseases, because if the rainfall will be there, more mosquitoes will be there and water will be there. So using these mosquito and water as vector, the uh, not water as vector but mosquito as vector, they can be the disease can be spread from one place to other. Which diseases have shown re-emergence after being previously controlled? So these are the diseases like tuberculosis, plague, diphtheria, dengue, cholera, and meningococcal meningitis. So it is not the reason that if you have controlled the disease once, it is not going to re-emerge. It can re-emerge. So proper control and surveillance is necessary. Give examples of newly emerged pathogens and strains. Newly emerged pathogens are HIV and Vibrio cholera serotype O139 and COVID 19. Why is antimicrobial resistance a major concern? Bacterial pathogens are becoming resistant to commonly available and affordable antimicrobials, making the treatment and control of infections difficult. The treatment, whatever is being given as antimicrobials, they are not treating the bacteria as they have developed the resistance. Name important pathogens which are showing antimicrobial resistance. So, Streptococcus pneumoniae, Haemophilus influenza, Staphylococcus aureus, Pseudomonas aeruginosa, Neisseria gonorrhoeae, Enterococci, Mycobacterium tuberculosis. These are very important pathogens causing disease commonly and unable to treat because of the development of the resistance for that particular drug. Why is reliable microbiological data important? It helps in development and validation of the standard treatment, design disease control interventions, ensure appropriate procurement and use of antimicrobial drugs. So if you know the organism, if you know which one is resistant, which one is sensitive in that particular area, you can give proper treatment. Then you can design their interventions. If you know how the disease is happening, then ensure appropriate procurement and use of antimicrobial drugs. What factors increase the prevalence of infections in developing countries? Answer is poverty, malnutrition, starvation, poor sanitation, poor personal hygiene, unsafe water supply, inadequate health services, lack of disease control measures, They all these all factors, they increase the prevalence of infections in the district. How do war and famine affect infectious diseases? They increase the number of refugees, reduces access to healthcare, and increase the infectious disease related morbidity and mortality. How do war and famine affect infectious disease? They increase the number of refugees, reduce access to healthcare, and increase the infectious disease related morbidity and mortality. So, number of people are more, and they are from outside, so they can bring different infections with them. The other thing is that healthcare is affected during this time because so many people are there to take care of. Why are infections common in area with high HIV prevalence? Due to immunosuppression, patient becomes susceptible to mycobacterium tuberculosis, streptococcus pneumoniae, and various opportunistic pathogens. Clinical microbiology and public health laboratory activities. Why is the network of district microbiology and regional public health laboratories necessary? So, to provide the accessible microbiological services to the community, because if there is only one office in the state, then it is difficult for it to control the district. So everywhere it is there in district also, and just to cover large proportion of community in a better way. What support do district laboratories require from regional laboratories? So, the support which the regional laboratory or the at state level, it should provide SOP preparation, that how the work should be done and whether it is being implemented or not. Safe working practices should be taught to them. On-site training should be given to them by these people. Then the quality assurance, supply of the essential reagents and culture media is very much required from them. Providing the appropriate, reliable, and affordable microbiological services. Who should collaborate in planning microbiological services? Answer is that laboratory personnel, clinicians, community health officers, and sanitary officers. They should coordinate with one another, and then they should come out with the proper treatment and proper prevention, surveillance of the disease or the infectious disease, because infectious disease is something which is present in the whole community and it can spread from one person to the other. So it is very much essential that all people should coordinate with one another. What infectious disease should be prioritized for laboratory investigation? So the disease which is caused by priority pathogens, this is the list given by WHO requiring the laboratory confirmation and surveillance. So it is very much necessary that it should be confirmed at the earliest, and then surveillance should be done, to for the proper treatment and prevention. What is the role of the district laboratories in disease control? Answer is that surveillance activity should be done, epidemic investigations, if any epidemic happens then it should be done, and reporting the microbiological findings. So this is the district laboratories. If they find such type of things, then they should provide this to the regional laboratory for better management. What laboratory techniques should be standardized? Specimen collection, pathogen identification, antimicrobial susceptibility testing. These all things are done in the microbiological lab. So from collection of the sample to the identification and proper antimicrobial susceptibility testing is very much important for the better treatment. Then why is the quality assurance important? What is the role of the quality assurance? Because it ensures the reliability, accuracy, consistency, and usefulness of the laboratory result. If you are not performing the test properly and you don't know whether it is right or wrong, then you have not compared it with something of A1 quality, then it is of no use. So, what factors should be considered while planning the laboratory services? So, training is required. So, training requirement, equipment needs, supply distribution system, and how much cost will be involved. These all things are very important. Now, operating the microbiological laboratory services with minimal resources. If you don't have a lot of money, then how will you manage? So, what are the major obstacles to establishing the microbiological laboratories in developing countries? So, if major obstacles, what are those? Because in developing countries, we think that there is a scarcity of the money and the support system, then high cost of culture media and reagent, poor selection of investigation, shortage of trained staff, limited financial resources. These are the problems which you can find in the microbiological laboratories of developing countries. So, what approach does WHO recommend for resource limited laboratories? So, if you don't have all these things, what WHO recommends for them? Cost effective, simplified, and flexible bacteriology approach based on priority grading of the pathogen, that this should be done first, this should be taken care of second, this should be catered because this is more serious, this is less serious. So what are the advantage of pathogen priority approach? Better resource allocation, preparation of essential culture media and reagents, focus staff training, and improve diagnostic efficiency. So if you know that this is the pathogen which should be done for the priority, then everything should be ready for those pathogens which are in the priority list than those which are not. So, pathogen priority approach, what factors are considered while grading pathogen priority? Frequency of isolation, if it is more, clinical relevance, if it is causing more disease, severe disease, severity of the disease, if it can lead to epidemic, it can spread, possibility for intervention is there, then cost benefit ratio of identification. So these are the things on which we put them in the priority list. Why may an important pathogen receive a low priority grading? Because laboratory direction may be expensive or impractical despite the clinical importance, then that is not for of priority for you. Is WHO pathogen grading universal? No, it varies according to the disease pattern, laboratory capacity, available resources, country specific needs. So, something can be of priority in one country, something cannot be of priority in the other country. Quality assurance and SOPs in microbiology. What is the purpose of quality assurance? To ensure the laboratory reports are reliable, standardized, timely, and clinically useful. This is the importance of quality assurance. Why are microbiological investigations important? Because you want diagnosis, you want treatment, then after that surveillance of the infectious disease should be done, and then you can go for antimicrobial policy formulation so better treatment can be given for the other people. Then what characteristics should a laboratory report possess? Answer is reliability. It should be reliable, it should be standardized, it should be timeliness in proper time, and it should have clarity. How does quality assurance reduce waste? By ensuring only relevant investigations are performed and results are properly utilized. Then, pre analytical stage. What should SOPs describe during the pre analytical stage? What is there for in the SOPs? What should be there? So, appropriate use of the investigation, then collection and transport of the specimen, then the correct completion of the request form, and specimen acceptance and rejection criteria. This all thing comes in the pre-analytical part. Why is collaboration important in selecting microbiological investigation? It helps prioritize investigation according to clinical and public health needs. It helps prioritize investigations. Let's prioritize investigations, right? So collaboration is important because you can prioritize that this is important, do it first. Why must microbiological specimens be collected correctly? Correct collection is essential for successful isolation and identification of pathogens and accurate reporting. What information should be included on a microbiological request form? So the patient name, age and sex, OPD IPD number, ward and health center, type and the source of a specimen. What is the name, like urine, and from where you have collected the urine. So date and time of the collection, investigate time is also very important. Then investigation, so if it is how you have managed the sample, whether it is in time or it is not in proper time. Investigations required, clinical diagnosis, so that you can correlate. Antimicrobial therapy details should be there. If antimicrobials have already been given, then culture is not possible. Then name of the requesting medical officer, so that you can coordinate if you want to ask something. Why is clinical information important on the request form? It helps the laboratory interpret findings and provide clinically relevant reports. What checks should be performed when a specimen arrive in the laboratory? Verify the patient identity, match the specimen label with request form, assess the specimen quality, check transport condition, ensure proper storage if immediate processing is not possible. Verify the patient identity, then match the specimen label with the request form, then assess the specimen quality, whether it is okay or not, check the transport condition, whether it was okay or not, and then whether the storage was at proper temperature or not. Which specimen require immediate attention, like CSF, blood culture, unpreserved urine, swabs not in transport media, fecal specimen containing blood and mucus, and the wet preparation. So this is a very important thing, that what you should know. Give example of unacceptable specimen, like dry fecal swabs you should not accept, because it is already dried. Saliva submitted as sputum, if you see the slide, you know, come to know. Old eye swabs, again it may be dried. Specimen in wrong container, leaking specimen, these all should not be collected. Analytical stage. What procedures should SOPs include during the analytical stage? Analytical stage. What procedure should SOPs? Analytical means when you are doing the culture and the sample is in your lab. So examination of the specimen, then you stain the procedure and maintain quality control with staining procedure. It should be aseptic technique, preparation and quality control of culture media, so that is important. Then inoculation and plating technique, so you are making the culture media, that time you have to put the quality control. Then inoculating and plating techniques, reading and interpretation of the cultures. Pathogen identification method, how you are identifying it by the biochemicals and all other tests. Antimicrobial susceptibility testing is the part of this analytical stage. Equipment maintenance and quality control, because equipments if not working properly, it's not going to give the fair results. Immunological techniques, safe working practices should be done, because once you start doing the microbiological work, your hand should not be contaminated, no contamination should be there in that place. Disposal of the specimen and culture is very important, but because it may lead to infection to the other disease, and so in analytical time you have to take care of all these things. Clinical cleaning of the laboratory wares, again cleaning is very important. Sterilization procedures are very important during the analytical phase, because otherwise you may report wrong and you may get contamination and not the right pathogen. Why is quality control of stain and reagent necessary? To ensure the accuracy and reliability of the microbiological test results. Because if you are not putting the quality control, you don't know whether the right how the right one will look like, then you may report in a wrong way. So, what should be monitored as part of laboratory quality control? The staff performance should be there. You should know whether the staff is doing everything properly. Then the competency assessment should be done of the staff. Quality control test results should be checked properly whether they are coming okay or not, and then the training records, supervision of the newly qualified staff. So these all are included in the analytical part.